I'm Dr. Imtiaz Ghani, consultant spine surgeon working at the Apollo Main Hospital in Chennai City. Today we are going to discuss an important topic which is called spinal ergonomics. When I say ergonomics, it means the postures that one adopts at their workplace. Considering the sedentary lifestyle that people adopt in this era, like for example people who work in the corporate sector who are into more of a desk job, and people who are not into too much of physical activities, they face a lot of spinal issues. In our outpatient department, we see at least a minimum of 6 to 7 people every day facing some spinal issue because of their sedentary lifestyle and desk job activities. So we need to understand how do we maintain our spinal health so that we prevent such issues happening in the spine, like say disc prolapse, which is the commonest issue. When I say disc prolapse, what I mean is that there is a gel-like structure which acts like a shock absorber between the spinal bones. So when this gel pops off, it starts to press on the nerve that goes to your arms or legs, and that causes for some people tingling, some people numbness, paralysis for some people, and sometimes it is also associated with severe excruciating radiating pain to the arms and legs and difficulty in walking or clumsiness of the hands and feet. To prevent this, the more earlier scenario that we can adopt is better physical activity. One thing, every day minimum of half an hour of exercise is mandatory. The food pattern that we adopt, avoid fast foods, avoid carbonated drinks, and take more of protein and fiber rich food. And the postures that we are going to adopt. Whenever you work, always make sure that you sit straight erect so that your upper and your lower back is well supported. And when you sit, always make sure both your elbows are well rested on your armrest or on the desk that if you sit, and where your hand ends, that is where you'll be placing your keyboard. And where your hand ends, that's where you should place your monitor well seated. Preferably use a desktop, because it's not mandatory that you'll have to keep bending your neck for long hours. Suppose you're going to use a laptop, use a docking station wherein like you can have a USB attached keyboard. It helps you work much better. And for every half an hour or 40 minutes that you're going to sit and work, try to get up like this, do a back stretch, a side stretch, and a little bit of a rotation, and just walk for 5 minutes and come back and resume your activity. So this is about it. The third most common thing that we see is people who are trying to lift weights by bending forward. Whenever you bend, always remember, keep your back straight and bend by your knees and do things rather than bending forward like this. When you bend forward like this, there is enormous pressure that is exerted at the disc space, and that causes, like for example, a person who is regularly doing this, his disc space starts to get degenerated. That what we call as a wear and tear. Somebody who is in the age of 25 will be facing an issue who has to face it at the age of 45. So this is what we are looking at. So ergonomic postures do play a major role. So the points that you need to remember is, the first thing would be exercise, the diet pattern that you adopt, and the third thing is how do you sit, how do you stand, and how do you walk during your regular day-to-day activities. So once you start remembering this and you start following this, maybe in 2 to 3 weeks this becomes a habit and you're generally not going to face any issues further on. Thank you.